Um, so thanks again for inviting me. So to tell you about where I come from and what my role is, I am a social worker that works at UCSF, Benioff Children's Hospital in San Francisco. My role is a patient care liaison with kids and teenagers that have lupus and their families. And so my role is really nuanced and really unique in that I only work with families impacted by lupus, and I'm able to follow them from diagnosis all the way until they transition into adult care. And when I'm following them, it really looks like a lot of education about lupus, um, kind of counseling and support to adjustment to the diagnosis, um, referring to community resources where they're available, um, and um, and also supporting transition to adult care. So creating a plan and making sure that young adults are feeling really confident about talking about their health and asking for what they need in terms of living with a chronic condition like lupus. So as you can imagine, I do a lot of communicating. I am kind of what they call a liaison between providers and patients and parents and caregivers and different aspects of the healthcare system. So I'm often on the phone with insurance companies or with pharmacies, supporting coordination of care for, the patients that are being seen by multiple specialties, and trying to make sure that, they can be seen in an efficient manner instead of having to, come multiple times for their care. So really what I'm going to share with you today is a kind of what I've learned from the families that I work with. It's a really big topic, communication, and I'm by all means not an expert on this topic. And so I'm just going to be sharing what I've learned from the families I've worked with for the last, 6 or 7 years. And I'm hoping that it can inspire some ideas for all of you. So why is communication important? Lupus can be life-altering, and so for many, it is life-altering. I'm not saying it can be. It is definitely life-altering. But unfortunately for many, lupus is kind of, it's invisible and unseen. And as a society, we unfortunately have a hard time believing someone is ill unless we can see it. So oftentimes we need to be able to communicate the impact so that we can get the help that we want or that we need. It's also, in the grand scheme of things, a very rare condition that many don't know about. And similar to any sort of history, we have to share it for people to learn more about it and to care about it. For me, sometimes it doesn't feel so rare because it's the only community and population that I work with. And so sometimes I forget that it is really rare. And I always have to take a step back and, for the last 6 years, and sometimes when I'm introducing myself as a lupus liaison, there's still very many people that are like, what is lupus? And so I'm always having to talk about it.